Once again, you are welcome to Angel Health Academy. Subject Community Health Nursing Mnemonic. Topic for the day is Family Health Services. Family Health Services. Let us discuss about family. Family stands for father and mother, including children with love and N. N is nothing but a strong desire to do something for the members. Let us go in detail about the family. Family is an outstanding primary group and it is the basic unit of all societies. Family is the basic unit of all the societies. And family is an universal institution. And moreover, it is a unit of services in community health nursing program. Family play a very crucial or important role in health promotion, health protection and health maintenance of its members. Definition. According to Burgess and Locke, family is a group of persons united by ties of blood, marriage or adoption, interacting and communicating with each other in their respective social roles. So, it's a group of persons united by the ties of blood, marriage or adoption, interacting and communicating with each other in their respective social roles. According to US Bureau of Census, family is a group of two or more persons related by birth, marriage or adoption and residing together in a household. In another word, family is a group of biologically related individuals living together and eating from a common kitchen and purse. Family is a group of biologically related individuals living together and eating from a common kitchen and purse. Let us discuss type of family. There are mainly three types of family: nuclear family, joint family and extended family. Nuclear family consists of a mother, father and their children living under the same roof. Nuclear family consists of married couples and their dependent children. The next is joint family. The joint family consists of two or more married couples and their children who lives together with the same household. Two or more married couples and their children who lives together with the same household. The last type is extended family. Extended family consists of members which extend beyond a mother, father and their children. A family with three generations may live together under the same roof is called an extended family. The family may include grandparents, aunts, cousins, uncles, etc. Extended family also known as three generations family. Next is functions of family. There are 7 major functions of family. First one is procreation and rearing of children, reproduction and taking care of children, physical care and affection, physical care of the members and affection, economic security, providing economic security to each other, socialization, education, division of labor, dividing the responsibilities, division of labor, and social care and control. The major functions of the family are procreation and rearing of children, physical care and affection, economic security, socialization, education, division of labor, social care and control. Other functions of the family include provide a residence, care during illness or sickness, recreational, religious and political functions, and welfare and protection of the family members. Characteristics of family. There are 9 features of family. First one is open to change, high self-worth, functional differences, clear discussed rules, open to express, clear deal with stress, welcome with life stages, clear-cut hierarchy, and affection is open. Open to change. Every family members are very open to change the roles, adjust with the family members. Every member is having high self-worth. Functional differences. Every person is having a separate and specific functions. So when a person has any disease, the other family members take care of the function of the particular person. There are clear discussed rules and regulations in the family. Every member has to follow that rules and regulations. And family is the platform to open to express by everyone. When there is a stress in a family, there is a clear deal by the family members. Family welcome all the life stages. The changes which occurs in the life, family will take positively and they welcome the life changes. There is clear-cut hierarchy of the family members and affection or love is open in the family. Everyone loves each other. The next is family life cycle or developmental stage. So there are 6 main stages in the family life cycle: family formation or establishment, extension or expansion, extension complete or stability, contraction, complete contraction or couple alone, and last stage is dissolution or disintegrations. Families are not constant and they are ever changing. That's what the stages will be changing. Let us discuss in detail about the phases of nuclear family life cycle and the events. I have been made a table with the 3 columns. The first column is the phases of family, nuclear family life cycle. Second column is beginning of the phase and last column is ending of the phase. So let us discuss each phase separately. First phase is formation phase, starting with or beginning with the marriage of the couples and ending with the birth of the first child. So marriage to birth of the first child comes in formation. Second stage is extension, beginning with the birth of the first child, ending with the birth of the last child. So birth of first child to birth of the last child, that cycle is called as extension phase. Then third phase is complete extension, beginning with the birth of the last child and up to the first child when he or she leaves the home. The period between the birth of the last child to when the first child leaves from home is complete extension phase. The next phase is contraction phase, that is a fourth phase, beginning with the first child leaves from home and ends with the last child leaves from home or the parents. So the period between when the first child leaves home to the last child leaving the home, that is contraction phase. The fifth phase is complete contraction, begins with the last child when leaves from home or parents and until one of the spouse dies. The period beginning with the last child leaves from home and the one of the couple or spouse dies. The last phase is the dissolution or disintegration, beginning with the when one spouse dies until the death of the survivor. The period between one of the spouse dies to death of the remaining survivor. So this is the phase of nuclear family life cycle. The next topic is family as the unit of service. In all the community health services, family centered. So family is considered as the unit of service. I have made a mnemonic. Family is basic primary unit in the society. So the mnemonic is basic, B-A-S, instead of I made E. So you have to read like, you have to remember like a basic, B-A-S-E-C. Let us expand B-A-S-E-C. B stands for biologic unit. A stands for a unit for healthcare. S stands for social unit. E stands for epidemiologic unit. And last C stands for cultural unit. Let us explain in detail. Family is considered as a biological unit because family procreate and perpetuate the life. That is, family maintains the continuity of the life. At the same time, family members share the pools of the genes. Thus, family is considered as a biological unit. The second is a unit for providing health care. Family is considered as a unit for providing health care. Family is the unit of providing all health and welfare services to its members. Family render comprehensive health care to the members. So family is considered as a unit for providing health care. Family also considered as a social unit because family members live together, interact each other, help each other and share the common physical and psychosocial environment. Because of that, family is considered as a social unit. Then fourth one is epidemiological unit. Family is the primary site of interactions of host, agent, environment. That is, epidemiological triad begins within family. Thus, family is the primary site of interaction of host, agent and environment. Health status of the members depends upon the changing environment or environment of the family. Thus, family is considered as an epidemiological unit. Then, cultural unit. Family is considered as a cultural unit because family members get socialized and learn culture of the society from the family. Family determines the attitude and behaviors of each members of the family. Thus, family is considered as a cultural unit. So, family is considered as a biological unit, a unit for healthcare, social unit, epidemiological unit and cultural unit. Because of these features, family considered as a unit of service. Related to the previous session, family as a unit of service justified. This is another question, important question. to be answered, that is justify family as a unit of service. Let us justify family as a unit of service. The first point is health of an individual depends upon the health of the family. So health of an individual of the family completely depends upon the health of the family. Second point, family members have interpersonal relationship and dependency on each other. Family members have interpersonal relationship and dependency on each other. Because of that, family is considered as a unit of service. Family is considered as a natural and fundamental unit of the society. Family is considered as a natural and a fundamental unit of the society. The fourth point, family support plays an important role in healthcare needs. Because family support all the family members. Family support plays an important role in healthcare needs. The fifth point is illness of the family members affect the total healthcare of the family. So when one person is suffer from any disease, that affects the total family. Illness of the family member affects the total healthcare of the family because health problems of the family are interconnected. Health problems of the family are interlocking. The sixth point is individual's health problem can be tackled and solved easily through family healthcare. Individual health problems can be easily tackled and solved through family healthcare. The seventh point is customs, traditions, habits and socio-cultural aspects of family are closely related to the health risks, illness and health behavior of the family members. So, the risk of the family members, their illness and their behavior, everything is closely related to customs, traditions, habits and socio-cultural aspects. Eighth point is comprehensive healthcare can be provided to the community through family health services. The comprehensive healthcare can rendered to the community through family health services. The ninth point is the successful family life cycle can be achieved by the family healthcare services. The successful family life cycle can be achieved by the family healthcare services. The last point, the 10th point is family is an effective and most available channel for mobilizing the health needs of the society. So we can understand the health needs of the society through family. So family is an effective and most available channel for mobilizing health needs of the society. The next topic is role of a family in health and illness. Role of a family in health and illness. There are 8 main roles for the family in health and illness. You can have a mnemonic like a CS, CS, PF, PF. CS, CS, PF, PF. So the first C stands for child rearing. Second S stands for socialization. Next, second C stands for care of dependent adults. Third S stands for stabilizing the adult personality. P stands for personality formation. F stands for family susceptibility to diseases. Second P stands for problem families. And last F stands for family broken. That is broken family. So role of family in health and disease, there are 8 roles: child rearing, socialization, care of dependent adults, stabilizing the adult personality, personality formation, family susceptibility of disease, problem families and family broken or broken families. Let us discuss in detail one by one. First is child rearing. The most important role of the family is child rearing. That is providing physical care to the dependent young in order to survive up to adulthood and later perpetuate the family. The practice of child rearing differs enormously from society to society and it depends upon the capital resources, level of knowledge, state of technology and state of values. Socially, it is determined by the tradition. Pattern of child rearing or child care includes feeding, nutrition, hygiene, clothing, etc. The second role of the family is socialization. Socialization is the process by which people learn to adopt the norms, values, attitudes, beliefs, code of conduct and behaviors. The family members learn to adopt the social norms, values, attitudes, beliefs, code of conduct and behaviors through the family. That is the key role of the family. The third role is care of the dependent adults. Family play a crucial role in during the care of the sick and injured in the family, care of the women during pregnancy and childhood, care of the aged people and even care of the handicapped. The fourth role of the family is stabilization of adult personality. Family is like a shock absorber to the stress and strains of the family members. Family members may develop stress from injury, illness, deaths, emotional upsets and economic insecurity, etc. And family provides a basement for relieving all the stresses and tensions. So family functions in stabilization of the personality of both the adult and children in meeting their all emotional needs. The fifth role of the family is personality formation. Capacity of an individual to withstand stress and strain are determined by the early experiences in the family. So family provide exposure to the family members to withstand stress and strain. Thus family acts as a placenta, excluding various influences, modifying others that pass through it in laying foundation of physical, mental and social health of the child. The sixth role of the family is familial susceptibility to disease. So genes act as a platform for carrying the disease over generations. The disease such as hemophilia, schizophrenia, psychoneurosis, congenital anomalies, communicable disease, etc. So family may inherit these diseases from the family members. That is a familial susceptibility to certain diseases by the family. Problem families. Problem families always have low or below the expected standard of life. And parents are even unable to meet the physical and emotional needs of their children. And problem families also may have an unsatisfactory living condition. That is, home life is utterly unsatisfactory and most commonly found in lower social classes. So problem families are most commonly seen in lower social classes and people with a low economic status. The last role is broken family. According to Dr. John Bowlby, parents had separated or one or both parents had died. Such a family is called as broken family. The victim of broken family may have mental deprivation and the children, even in early childhood, they display psychopathic behavior, immature personality, growth retardation. And in future, they drift away towards prostitution, crimes, vagrancy. Vagrancy means wandering from home, etc. So these are the 8 important roles of family in health and disease. Moreover, in short, the somatic symptoms always increases the tension among the family members. Chronic illness and complicated illness is related to the family functioning. Family prestige is affected by mentally retarded child. The family will offer remedies and always advices to the family members. It takes over the role of the ill person when he or she is no longer capable of performing, and it will provide care until the recovery and long-term support for the family members. So these are the important role of the family in health and illness. The second session of the day is family health. This is the same definition WHO has been given for the community health. Only that instead of community, they have changed the family. So family health refers to the health status of the members of the family, to the problem affecting to their health and totality of health care provided to the family. Then another definition of family health is, it is a state of positive interaction between the family members, which enables each members of the family to enjoy optimum physical, mental, social and spiritual well-being. The factors related to family health. Factors influencing the family health. There are 4 important factors which influence the family health. That is family income, available health services, culture and environment, and education or literacy of the family. So I have been made a mnemonic like a phase. F stands for family income, A stands for available health services to the family, and C stands for culture and environment of the family, and E stands for education status of the family members or literacy of the family. So these are the important factors which influence the family health. The third session of the day is family health care or family health services. Family health services is the central point of health services. It is a central point of health services. It is an important component of health for all goal. Family health nursing is the pivot and essential component of family health. Family health nursing is the pivot and essential component of family health. Family health nursing. Definition and meaning of family health nursing. Family health nursing is a nursing aspect of organized family health care service which are directed or focused on family as the basic unit of care with health as the goal. Objectives of family health services. The general objectives of family health services or family health care services are to learn how to make a family diagnosis within the available health resources. So, to learn how to make a family diagnosis within the available health resources. Second general objective is to help family make an intelligent use of promotive, preventive, therapeutic and rehabilitative health and allied facilities and services in the community. The maximum utilization of the services available in the community by the family. These are the two general objectives of family health care services. The specific objectives of family health services are: first one is to assess the socio-demographic, economic and socio-cultural factors of the family. Second one is to assess the health problems of the family. Third is to assess the immunization status, health status and nutritional status of the under 5 children in the family. Fourth one is to assess the dietary intake of the family members by 24-hour record. And fifth one is to provide the recommendations and actions necessary for the optimum health of the family members. The sixth specific objectives of family health services is enhance the family's acceptance and understanding of the problem. So, make the family to accept their health problems and understand the severity, urgency and consequence of their health problems. Then, seventh objective is to provide comprehensive nursing services according to the need of the family, according to the needs of the family. The eighth objective is helps to develop competency in family members. So, help the family members to develop a competency of self-care. Ninth objective is provide health education according to the needs and significance of the problem of the family, either by a planned health education or by a incidental talk. The 10th objective is promote the maximum utilization of available resources by the family members from the sub-center, from the primary health center and from the community health center and other governmental sectors. So these are the 10 specific objectives of family health services. Next is the aims of family health services. The important 5 aims of family health services are reducing infant mortality rate, maternal mortality rate and maternal morbidity rate. Spacing the birth of the children between 3 to 4 years. Helping to solve the malnutrition among the under 5 children in the family. Providing health education according to the need and significance of the health problems of the family and demonstrating the various procedures, self-care procedures for the family members to take care of themselves. The principles of family health services. I have made a mnemonic here. Principles of family health services is family focused. For the purpose of making mnemonic, family I made FAMLI, then focused. Let us expand. F stands for family focused. A stands for active community participation. M stands for maintain good IPR with the family members. L stands for local available resources in realistic. I stands for identify and prioritize the family health problems. Focused stands for full family participation in decision making. Let us explain in detail. F stands for family focused. So first principles of family health services is family focused. That means family health services should be specific to each family because problems of the family varies from one family to other family. Then render family health services with the active community participation. Maintain good IPR with the family members. Then provide or render the health services to the family based on the locally available resources. That is local available resources in realistic. Then identify the family problems, health problems and prioritize the problems and provide the health services according to the priority. Sixth principle of family health services is enhance full family participation in decision making, that is in planning and implementing various health services to the family with the support of the family, with the involvement of the family. So these are the 6 principles of family health services. Next is sub areas of family health services. The major or important sub areas of family health services includes maternal and child health services or RCH services, that is reproductive child health services, family welfare services, nutrition and health education. So MCH or RCH, family welfare services, nutrition and health education. Then the role of a community health nurse in family health services. There are 9 different role or specific role for the community health nurse in family health services. First one is direct care provider to the family. Then educator, health educator, coordinator and collaborator, coordinate the family health services and collaborate with the other health related sectors. Advocate, provide the right information to the family. and make the family to choose the right healthcare services. Act as a consultant to the family members. Inform the family members the available resources by the government sector. Let them maximum utilize the available resources, or help them to utilize the maximum utilization of the available resources from the community. Then act as a counselor, so counseling the family members or providing psychological support. And act as an environmental modifier, that is, identify the hazards, environmental hazards, and protect the family members from environmental hazards. Act as a case manager and provide the specific care to the family member who are suffering with a particular problem. Then act as a researcher, conduct various research activities based on the family health services. So thanks for watching. I hope this video really benefits in your studies. If you feel it is worth, please like, share and subscribe. Stay tuned with the Angel Health Academy till we meet with another important educational video. Thank you.